After dusk on the outskirts of Delhi, the battle for breath continues. This is a desperate rush to get oxygen to a woman on the brink of death. But for all the effort of volunteers, it is not enough. As her family say goodbye, more patients arrive. Manoj Kumar has brought his 70-year-old mother here for care. She can barely sit up.
I came here because I didn't get any help elsewhere.
With oxygen supplies and hospitals exhausted, the yard of this house of worship in Ghaziabad is a major front line against COVID.
There's now a panic over lack of oxygen across India, and as a result, people are dying on the roads. Now, we've started to provide mobile oxygen. We provide cylinders to people's cars to try and save their lives. As of now, 36 hours have passed and about 700 patients' lives have been saved.
Across India, this despair is turning to anger, not only over the government's mishandling of this outbreak, but over its attempt to shut down dissent online. Twitter has removed critical tweets after requests from the government. The platform told Channel 4 News, "When we receive a valid legal request, we review it under both the Twitter rules and local law. If the content violates, the content will be removed from the service. If it is determined to be illegal in a particular jurisdiction, but not in violation, we may withhold access to the content in India only." This here is an example of a tweet that can be read in the UK, but not in India, as the government continues its crackdown on social media companies and free speech.
Modi seems to operate under almost an autocratic system of if it doesn't get reported, it doesn't exist. And this is what the government is trying to do. Tweets which report actual facts, which can be construed as being criticisms of the government, have been taken down without any explanation. They are not factually incorrect. In our case, our handle was taken down for several hours while covering the farmers' protests, which were huge in January, without any explanation. Later it was said it was a threat to public order. What does that mean?
For you, what is the message to the international community?
India desperately needs vaccines. We need oxygen import. We need whatever help the world can provide us.
This is the UK's contribution, a package of medical equipment on its way to India. This dystopia is not supposed to be happening. The number of patients being cremated should not be rising. But here, victims are being given their last rites. In this resurgent fight against COVID, India